not only does it apply to the patient, but it applies to the operator as well, because this is my first clinical case. Hi, I'm Dr. ALYSSA. I empower people smile through orthodontics by giving them the confidence they need. Okay? So, fellow judges and participants, are you ready to listen to my first clinical case presentation?
Yes.
So, let's call my patient Mr. RD. He is a Malay male born on 12 July 1999, which makes him 22 years old 4 months, when he first came to visit me at my dental clinic on 21st December 2020. He first came in complaining of being unhappy with his upper front teeth that are inwards and food stuck when eating. His current misalignment is affecting his confidence rating. He has no medical problems, which makes him fit and healthy, no allergies to any food or medication. He is a regular dental attendee. Currently, he is unemployed. He is waiting to further his studies overseas, but due to COVID, at that time, he had to postpone his studies. He has no relevant medical or dental family history, and he brushes 2 times a day.
Never mind, we can see.
Okay, so you will just tilt your head a bit to the right and you can see it in this photo. Okay, so he presented with a symmetrical face with slightly increased lower facial height, and his center line does not coincide. His soft tissue, he has normal upper lip length with completed lips. Facial profile is straight. PMJ, lymph nodes, no abnormalities detected, and he has no habits. So again, I'm so sorry. It was okay in my computer, it was under PowerPoint, but maybe Google Slide is trying to sabotage me today. So just tilt your head again to the right. Okay, so these are his extraoral photographs. Okay, these are his intraoral examination. Okay, so soft tissue, there's no abnormalities detected. He presented with a square-shaped upper and lower arch. He has no caries and he has unerupted aids. His oral hygiene was fair with minimal bleeding on probing. According to the PPE, it was at section 1, 2, and 5. So for occlusive analysis, he had cross bite present at tooth 1, 3 to 4, 3, tooth 1, 2 to 4, 2, and at 2, 2 to 3, 2, and 3, 3. For pre-treatment, these are his intraoral photographs. Okay, for pre-treatment occlusal features, incisor relationship, he presented with a class 3, with a negative 1 mm overjet and a 0 mm overbite. His center line, upper midline, is shifted to the left by 1.5 mm. Molar, class 1 relationship and class 3 canine relationship. For right buccal segment, it was a molar class 1 relationship and a class 1 canine relationship. Other occlusal features that was presented is that he has buccally erupted 1.7 and 2.7. So this is his pre-treatment radiography assessment. Okay, let's move on to the lateral cleft. Okay, so according to the lateral sabermetric tracing analysis, I'm going to point out the abnormalities. Okay, so the A and B is 0.80 degrees, which makes him a class 3 skeletal relationship. Width appraisal is negative 2.57 mm, which gives him a skeletal class 3. Upper incisor to maxillary plane is 170 degrees, 0.22, okay, which makes him have a proclined upper incisor. Upper anterior face height is 60.01 mm, which gives him have a large upper EFH and lower anterior face height at 71.91 mm, which also indicates that he has a large lower anterior facial height. Okay, so summary of the completion of the result, it shows that the position of maxilla in relation to the cranial base and position of mandible in relation to the cranial base is normal. However, position of the upper incisor in relation to the maxilla is proclined. Position of the lower incisor in relation to the mandible is normal. The growth is normal, and vertical component facial proportions is proportion. With his study model, we did an analysis, and it shows that the upper arch has a 7 mm crowding, lower arch has a 4 mm crowding. So according to the Bolton's analysis, it shows that there is a mandibulary excess, and for the anterior ratio, it shows that the mandibulary excess, there is anterior mandibulary excess. So according to the index of treatment need, especially and then we'll have to hold it, he is at number 3. And at 3C, it shows that the anterior or posterior crossbite with more than 1 mm but less than 2 mm discrepancy between retruded contact position and interclassical position. So as a diagnostic summary, Mr. RD, a 22 years old Malay gentleman, denies of medical problems, complained of his misalignment of teeth is affecting his confidence, especially his upper front teeth are inwards, and he also complains of food stuff when eating. He has a class 3 incisor relationship and a class 3 canine relationship on the left side, class 1 canine relationship on the right side, based on the class 3 skeletal pattern. He is a non-growing CVM6 patient with overjet of negative 1 mm, overbite of 0 mm, and molar relationships is in class 1. So, the patient's problem is Mr. RD has crowding on his upper anterior and posterior region. 2. Crowding on his lower anterior region. 3. Anterior crossbites. 4. Class 3 canine relationship on the left side. 4. 5. Upper midline shifted to the left by 1.5 mm. And last but not least, he has a reduced overbite and overjet. So, for his case, my aims and objective of this treatment was 1. To relieve crowding on upper and lower arch. 2. To correct his crossbites. 3. To correct the canine relationship on the left side. 4. To correct the upper midline. And 5. To correct the overjet and overbite. So, the treatment plan. As mentioned, his oral hygiene was fair with some bleeding or probing. Hence, first, the most important thing before patient puts on braces is to give them a good oral hygiene instruction and make sure the oral hygiene is excellent. Second, we did scaling and polishing. Third, the next step was to put on braces. So for his case, because it shows that there is mandibulary excess, we plan to do tooth reduction by stripping.
This is. Hold on, sorry, yeah. Wait for a while. Projector.
And it's on in his feet.
It's a, yeah.
But it's on here. It's on.
Yeah.
This is
Cable again.
cable, yeah.
There.
Oh, okay, alright. Okay. Thank you for letting me know. Otherwise it would be okay. So last but not least, after removing the braces, we will issue in retainers. So mid-treatment. Okay. So date of starting treatment was 21st December 2020 when he first came in. At that point, the patient was 22 years old, 4 months. And date of bonding braces was 28 December 2020. He was really excited. He kept calling me, when can I put on my braces? I told him, hold on, I gotta make sure your treatment plan is ready. Okay? So date of mid-treatment analysis, this was taken in June 2021. So pre-treatment sequence, as we can see, at day 0. We put on braces. I put on a copper 95014 for the patient, a universal arch. So this was at 3 months. And as you can see, once all the teeth separated,
projector. Doctor. I think we use that computer there better.
Yeah. All right. Yeah.
I think I just need to hold it like this. Let me just try it. Okay, yeah.
There's the cable again. Yeah. Okay.
Okay,
Yeah.
so I think another point that I did not expect was that when I bonded the Barkley erupted 17 and 27, this will intrude it and make it have an overbite. So at this stage, I panicked. Dr. Kaki, help me. Okay, but I informed the patient. Okay, this is the situation. We have a Barkley erupted 17 and 27. We're going to correct it. At this point as well, he told me, Doctor, I'll be leaving to the UK in September. Please help correct my bite by then. So I told him, okay, what I can do is probably I can help align the team. I may need to disengage the servants because it will simplify the treatment. He agreed. So I disengaged the servant. So this is the patient at 5 months. You know, just try to close your eye a little bit and just ignore the servant. I know it looks partially erupted. It was disturbing me as well. But patient's main objective was that he wanted his anterior teeth to be straightened. So I used some elastics on the posterior to help close up the bite. And at 7 months, his anterior teeth was all closed and his posterior bite was good. Okay, so again, tilt your head a little bit. So this is the patient at day 1 of putting on the braces, 3 months. Can you see how his smile is starting to get, you know, better and better?
Wider, yeah.
He was really happy, even at 3 months. So this is 5 months and this is 7 months. Okay, so mid-treatment occlusal features, it shows that, you know, at that point, in July 2021, he was still a class 3 incisor relationship with overjet of negative 1 mm, overbite of 0 mm. Upper midline deviated to the left, but instead of 1.5, it was 1.0 mm. Left buccal segment, molar was class 1, canine was still class 3. Right buccal segment, molar and canine was both in class 1 relationship. Other occlusal features, you know, the Barkley erupted 17 and 27. Post-treatment. So the date of the end treatment, the bonding of braces, was 10th December 2021. And if I'm not mistaken, a few days later, he already had his flight to go to the UK. At that point, the patient was 23 years old, 2 months. So, early deborn, because patient will be furthering his study overseas, and he won't be able to come back anytime soon, especially with the restrictions. So post-treatment extraoral photographs. His hairstyle also changes as you notice, right? Okay, so these are his intraoral photographs. Upper and lower, right and left. Okay, so post-treatment occlusal features, the incisor is now in class 1 relationship. Overjet is 1.5 mm with an overbite of 2 mm. The center line, however, is still not corrected perfectly, but we managed to reduce it by 0.5 mm, making it shifted to the left by 1.0 mm. Left buccal segment, molar class 1 relationship, and canine, you know, previously was a class 3, we made it into class 2 to overcorrect it a little bit. Right buccal segment, both molar and canine is at class 1, and again, Barkley erupted 17 and 27. So this is the post-treatment OPG. As you can see, there is some resorption, but very slightly. Post-treatment lateral calf. Okay, so this is the tracing and analysis. So as, again, I'm just going to point out the abnormalities. It shows that the A and B is still a class 3 skeletal relationship with a width appraisal of skeletal, class 2. Upper incisors to maxillary plane shows that the upper incisors are still proclined. Lower anterior face height is is 72.23 mm, large lower and zero visual height. Okay, I think this is also because when we align everything, we cause it overwide so that it increases the lower visual height. So this is the supra imposition. You can see clearly like it's moving. Okay, so it shows that especially the upper and lower incisor is at a more healthier relationship and vibe. Ta-da! Okay.
Yay.
So let's go through again the aims and the objective of the treatment. It was to relieve crowding on upper and lower arch to correct the crossbite. So okay, let's go one by one. Yes, we managed to relieve the crowding on upper and lower arch. Yes, we managed to correct overbite. Yes, we managed to correct the canine relationship on the left side. In fact, we managed to overcorrect it a little bit. Okay, to consider the relapse that might happen. Yeah, we didn't manage to correct the upper midline. If the patient just gave me a couple more months, I'm pretty sure we would be able to correct it. But because he was also in a rush, he was also already happy with his knee. So I told him, okay, to correct the overjet and overbite, yes. So for critical appraisal, early Ebon, the patient's other commitments, didn't manage to achieve all of the treatment's aim and objective. However, the patient's expectation was not high. So this part, to my surprise, he came back in September 2022. He came to visit my clinic by surprise. No complaints. He was just really happy to say hi and to ask how's everything going on. I was really excited to see him as well. And at that time, I had a little bit of free time. I said, let's come over to the chat, let me take some photos and review you. So still that very happy smile, you can see. He was back for his summer break.
Yeah.
So intraoral photos. So for this case, I issued him an Essex retainer and also I put on a permanent retainer. Because of, we had to remove it quite early, which was not what I would have wanted. But so the permanent retainer still looks good. I just had to retouch just for tooth. As you can see, it went upwards a little bit. Yeah? So that one was because the composite of the permanent retainer was, but patient was okay.
Yeah.
The most important thing is when you see a patient, don't point out whatever that you ask them. What do you think? I think it looks great. Okay. But we just take photos and this is what we send from the patient, So, are you ready to listen to what the patient has to say?
Yes.
Yeah? So this is just a short here. It's in Malay, but I'll translate it later.
Is the sound on?
Let's try to do it. Oh, I guess it doesn't want to play.
Is the sound on the project? Yes. Are you on PowerPoint? Because sometimes you have compatibility issues.
It's a good video, so I would really love for you guys to see it. Maybe we can just download it.
just kidding before you did it.
Yeah.
Yeah, okay. I was just about to compliment the patient for his alright.
But it was very minimal. Like, to my surprise, usually with patients, when we put a permanent retainer, you'll see like pustules here and there everywhere. But I told the patient, if you still want, good teeth, you gotta make sure you wear the retainer, all the time, even though you have a permanent retainer on, and you gotta make sure you floss every day. So he told me I did floss every day, and I did, wear my retainers all the time.
Can I ask a question? Why did you take off the bonding on the 7th again? What was the factor?
Yeah, because when it was buccal erupted, and then it pushed it down, and it causes the others to have an open bite at the anterior.
That is, I think, the most critical part, isn't it? Okay, now your reviews.
Ideally, I mean, now, what we can do is we can intrude the severs, we have pads and all that, but this would prolong the treatment.
Exactly.
And patient wouldn't be happy because he wouldn't be able to achieve what he wanted before leaving.
Yeah. Should be able to play now.
Yeah.
Okay, but it's okay. You have 5 more minutes.
Can you hear? Is it a video?
Yeah.
Okay. Okay.
You want this? Saya dapat pakai melalui website, anda dapat import dan buka braces. Bila anda masa makan, braces tak? Kalau dia baik sikit lah, tak adalah keluar bercakap pun rasa incompetent. Macam sikit, setiap rawatan memang tenang.
Maybe you can just translate what he's saying.
So, at the beginning of the video, he was like, you see this? You see this? You want this? That's what he said. So, looking at him from like the day he first came in to the day that I removed his braces, I could see itself, with his personality as well, the confidence in him. And in second, he mentioned that now when I eat, I don't have that much food stuff. Which was one of the patient's main concern. And second, he mentioned that happy to go out, talking to people, being confident in smiling more. Okay, so I'll just show my last slide.
Yeah, please proceed. All right.
Okay, yeah. So this is me and the patient. So patient achieved what is most important. He's gained his confidence through his new smile. Thank you.
Thank you so much.
I think we are ready for questions coming from the participants and also the judges. If you guys have any questions to Dr. ALYSSA?
I think everyone's like, I better not answer it. I better not ask any questions. Later she'll ask me questions. No, it's okay. Feel free to ask me any questions.
What was the total treatment time?
It was December to September, so it was 9 months.
9 months. And how long would you think that you're going to have the permanent retainer on for him?
I would feel that I would put it on as long as his oral hygiene is okay.
Right.
So if I find that when he comes yearly for his checkup, yearly because he's overseas, otherwise 6 monthly. If I find that he's not able to take care well of his oral hygiene, I would say, okay, the permanent retainer has to go.
Yeah.
Because at the end of the day, the most important thing is, gum and teeth health.
Right. Okay. Thank you so much. Wonderful.
The first time they came in with the crooked teeth, they don't want to smile so much when you take pictures. But comes in 3 months after, they can't stop smiling.